Hello, Guru Nation. Welcome to the Clinical Trials Guru, and also, everybody, this is episode 198 of Random Musings from the Clinical Trials Guru podcast. This is going on YouTube and the podcast. I'm interviewing today Christopher from Atlanta, which is a crowded job market for CRAs. Christopher just got a CRA position. He was a CRC coordinator, and we're just going to get into what it's like to go from coordinator to CRA, what that process was like. But before we do any of that, Christopher, first of all, thank you very much for agreeing to come on. Second of all, congratulations. That's not an easy task, what you did, but you accomplished. I mean, this is a major milestone in your career. So hats off to you. And let's get into who you are. Can we get into like your origin story?
So I'm originally from Mississippi. I moved to Atlanta about 8 years ago for my career. I just wanted to, be in a bigger job market where I could, kind of start my career. I knew absolutely nothing about clinical research. My first job was as a clinical trials assistant, and it was a year contract, and it was really nice.
How did you get that job?
Actually, I got the job. I was applying for a research to do bench science, and I sent my resume, and the person got back with me, and she was like, "Well, I'm not able to hire you for this position, but I can refer you to someone else." And so that person knew my mentor, and they hired me over the phone.
Oh, good. That's how it works.
So it was really good, and I really enjoyed it. And it was in prostate cancer, and I did, minor stuff with IRB, and it was very, very basic. And so once it ended really fast because it was a year contract, and so I ended up leaving clinical research because I knew absolutely nothing about it, and I always wanted to get back. And so many, many years later, I say about 5 years later, I kind of was like, I want to go back. And so that's when I landed a coordinator role in neurology.
Beautiful. Was it difficult to go back with that gap on your CV? Did you have a big gap on your CV?
So there actually wasn't a gap. I went to the public health sector and worked for a public health company and worked heavily in that field for a couple of years. And so when I started, applying for coordinator roles, it just really happened so fast. I applied and like 2 weeks later, I'm working.
Wow.
So
what year was this?
This was in 2016 when
the market was busy then, yeah.
Yeah, and it just happened so quick. And so I was like, okay, well, let me get back in it. And that's when I really started to learn a lot about clinical research.
See, you got in at the right time. And for this, too, we're going to get into the transition from CRC to CRA as well, because you entered at a really good market. I mean, it's as busy as I've ever seen, and I've been doing this for 13 years. Maybe it's because I'm getting busier, I don't know, but I'm seeing like much more activity. So I think and I'm hearing that from colleagues as well. So how many years were you a coordinator? You said 2016 until recently, so 2 years?
So I was, 2 years as a coordinator, and then when I left, so I would say about in all, probably 2.5 years.
2.5 years. And what gave you the idea, what possessed you to want to become a monitor?
So working as a coordinator, I had several monitors that I, worked alongside with a lot of my studies. And so I didn't know what a monitor was until I started, getting visits, and I started to, gain a relationship with the monitors and see exactly what they do. And a lot of my monitors were like, "Yeah, I think you will be a great fit." And they were like, "Oh, you're a new coordinator. It's going to take you probably about 5 or 6 years to even, get into the field." So I'm like, "Well, yeah, it's going to take me a while." And it actually didn't take that long, but
shouldn't take that long.
Yeah, because I was kind of brand new in clinical research. I was really didn't know much about it, about clinical trials and the foundation of it. And so I was going to give myself about 3 or 4 years before I started applying.
But why did you do it sooner? Like what? Why?
So I felt, I I really love the field, and I have a strong passion for clinical research. It's really a passion of mine to serve others and knowing that I'm helping them in some way. And so I said, let me take this step and try to start applying to these companies. And so that's when I started. I started like in the same year. I started like in November of 2016.
Wow.
I said, I am ready to grow. I feel like I can just start putting myself out there. I just really want to grow in the field and learn more about it. Because at that time, I was learning a whole lot about clinical research and what it entails. And so that's when I really started to apply.
And so you started applying, and then how long, what was that process like? I mean, how long from that point, late 2016, until you got hired? I mean, I can do the math, but it's like a year and a half, right?
Yeah.
So how many applications, how many interviews, how many rejections? People out there watching and listening think, they get so discouraged after like 3 interviews.
Yeah.
And it's like, that's normal. Like, if I've been doing this 13 years, if I go apply at 3 interviews, I'm probably not going to get all 3 of them. Like, I'm not going to get offers. Like, what makes you think you will? Like, it's not easy, right?
Yeah, it's not easy at all. It's a really tough field. It's not easy, but you just really have to be diligent. And I would say, just guessing, I applied to probably over 250 CRA positions.
250.
And I'm really just giving helping myself out with that. It was probably more, but I will say probably about 250 applications. And I started getting interviews, phone interviews, phone screens, and it just was not working for me. And
what was not working? What was
they were saying, well, I think you need more experience. You haven't been a coordinator long. I don't know if you'll be a good fit. And as I got more experience, I started to get more interviews with pharma companies, with CROs, and it was the same thing. I even had companies to fly me out to face to face, and it just wasn't working for me. And I would say what really did it for me, actually, is when I got a coordinator role in oncology. That's when the interviews really started rolling in heavily.
So walk me through that. So you were a coordinator previously, not for oncology.
No.
What kind of coordinator? General medicine?
Neurology.
Okay, like me, like central nervous system.
Yes, central nervous system.
All right.
And pediatrics.
Oh, okay, you guys did more on the neuro side. I'm more on the psych side. But yeah, same kind of things.
Yeah.
Okay, so that makes sense. So you went from like a niche that is still in demand, but it's not as in demand as oncology. People don't understand how big this is. Every year, it's about 50% of clinical trials are oncology. So it's really like in a category by itself. It could be its own industry. Like you have clinical research and then you have oncology clinical research. Those could be considered like 2 separate industries almost. Yeah. So you went from one with, it was like a niche to oncology. So it opened up like 50% more possibilities for you.
And that's when companies really started just like interviewing me. Now, they were coming. And although they were coming, I still was not, I felt like I wasn't getting any closer.
Yeah.
I was still kind of discouraged because the companies were like, we want you to have this, we want you to have more experience. But they were coming left and right. It's almost like that when they see.
And how long were you working as an oncology coordinator?
Actually, I was working as an oncology coordinator for like 8 months.
And that's all it took?
I would say 6 before I started getting really, really good interviews.
You see that 2 years or more is no longer the case. It's now 2 years or less. And what that actually means is, do you know enough for us to hire you, basically?
Yeah. And in oncology, I will say, that is one of the toughest therapeutic areas, and you're forced to know everything about clinical research.
Wow.
And you're forced to know it. And I wanted it so bad because I really like it. And so I just really, took notes from different people, and I have a binder full of everything about clinical research. I study it and make sure I know what I'm doing, know just and also learning it at the job as well. But oncology will get you right on the right track.
Mm-hmm.
So
What kind of oncology site were you working at?
I was working at you mean
Like, was it a small mom and pop type of clinic, or
oh,
was it like a university?
it was a university hospital. Yeah, really, really big.
Was that easy to get hired there as a coordinator?
It was really well. It was really easy to get there because they're so high in demand,
Mm-hmm.
and it was really easy to get in. But
Okay.
of course, it's easy to get in, but it's even more tough when you're there.
It's tough to stay in there with all the work they give you. I mean,
Because you're overloaded with 10 studies, and one is enough in oncology.
one is more than enough.
One is more than enough to try and grasp.
Wow. So they gave you 10 studies.
Yeah, and you're on
What
them,
were
and
you doing? You were doing everything in all of them?
yeah, they're steady coming down the pipeline, and they're steady coming from, all over the place. And so you're coordinating all of these studies, and you have no other choice but to know them. You have to really know the studies, and a lot of them are similar. So you just really have to be very detailed and be very careful about
So
these
as a
studies.
coordinator, what were you doing at this hospital institution? Because at my clinic where I'm sitting at now, our coordinator literally does everything: recruits patients, does regulatory, data entry. I mean, she has assistants helping her, but she does all of that. Was it the same thing with you?
So I think the bigger the hospital, the better, or the clinic or wherever you're working, because we have a department that does everything. We have a department that does the regulatory. We have a department that does the IRB department. We have a department that schedules, a department that does blood samples, which takes a lot of stress off of the coordinator.
Mm-hmm.
Basically, as a coordinator, I'm consenting, recruiting,
Yeah.
and just coordinating the entire process,
Yeah.
the different cycles of the clinical trial. And
It's a
so,
lot.
and I've also worked at clinics where I had to do everything. I had to do the blood draws. I had to, do the kits and all that. And
You were like Monica over here for me.
I had to
She
ship
literally does everything.
everything. I had to ship. I have to work with regulatory, and it's a lot. But it was a breeze for me when I started working for a bigger company because you literally have someone who do everything, so you can basically focus
Right.
on patients and focus on the trial.
Now, looking back now, do you think because you had to wear so many hats in your first job where you had to do everything, like Monica here, do you think that helped you get the CRA position? Like, let's say you were just doing that oncology CRC at that hospital. Do you think you're better off because of your previous experience, or are you worse off because of that?
I am most definitely better off because even in the interview, once they knew everything that I've done, it really was really a really big thing for me that really kind of took me over the edge and got the job because I did everything. And once you go to a site where you don't have to do all those things, it's a less stress,
Yeah.
and also you can just focus and you just grasp things really really fast. And my thought, and I had heard a lot of stories about oncology, how it was so intense and how it was so complex, and it is, but it's a good thing.
So your roadmap when you got started was, how can I get to be a CRA in as short a time as possible, right?
Yes, I had mentors who would help me and who would go do mock interviews with me, and there were sometimes they would tell me, I don't think you're ready. What really, and you know what you're doing, but I don't think you're ready. But what really, really did it for me, and I will be honest, when I got that job in oncology, that's when everything started to just like open up for me. I started to really know the foundation and what I was doing, and it just taught me a lot of things that neurology didn't teach me.
Right.
Yeah.
I'm going through some of our text because at this time you were texting me, so I'm trying to get like the history.
Mm-hmm.
Yeah, nailed the CRA interview, waiting for my offer. First time in history they were training CRCs to be CRAs, right?
Yeah.
So
Yeah.
you were is this called the Bridge program? That
So actually, this company they don't have a program. They were just implementing it. So we were going to be like the inaugural class
wow.
to come in to be the first class who they actually trained
Wow.
for this program. And the interview went amazing, but it just wasn't time yet for me. And of course, I was discouraged. Especially because every interview I have, they're like, "We love your passion. We know that you're passionate about it. We feel it. We see it." But
Ah, yeah, I see. Now I'm reading further. I didn't get selected. Yeah, you were pretty frustrated there. And I said, hey, man, it rarely happens after one interview. You need to apply to 200. That's literally what I told you. And
yeah,
then it pretty soon, like, it looks like 2 months later is when all this good stuff started happening for you,
yeah, it was like
right?
2 months later. Yeah, it was
Wow.
like
So they pretty much offered you the job, and then they said, actually, we take it back. We're not going to have you as a CRA now.
so the first interview that I went on this summer, they didn't offer it.
Oh,
It went so well that I just knew I had it because they were opening 15 positions. And
okay.
it went so well that I was like, oh, I know I have it. I know I
Yeah.
do.
Yeah.
And it was around, they were like, you didn't make it. And, I had to just like,
No
you
reason?
know, I had to just reevaluate myself and like, what is it that I'm doing? Because,
Yeah, but
you
what
know,
did they tell you? Like, they didn't
it
give
was,
you any reason?
this is just one of those general emails like,
Mm.
we've moved on to the next.
Wow.
Yeah,
Wow.
it went amazing. The interview went amazing. But I just, I had to look at it and say, Chris, it's just not time yet. You just have to really just get better. And
And then
I
2 months later, you got it.
and 2 months later, I got it.
Now,
Yeah.
did they come after you or you applied? Like, did you just put your resume out on job boards and waited for the phone to ring, or how did that work?
Literally, I applied. I saw the position. I applied for it, and the next day, I get a call.
Wow. Okay.
And then I had an interview with that person. Then the next day, I get another call, and then that's when I was flying to the company and having the interview, and it went so amazing. I really enjoyed everyone, the warm welcome. It was just the ambiance and everything was great. And so, yeah.
What was the interview process like? Can you give like Guru Nation a little synopsis of what the interview process was like? How many? Who? What? Did they interrogate you? What did they do?
So basically, with the interview process, it's kind of like most interviews. Like the HR person calls you first and does a screening, and they usually pass it on to the hiring manager. The hiring manager does a screen, and then after that, they fly you out. I mean, it really happened so fast. It happened like in 2 days.
Really?
And I was flown out, and great interview. The interview was 3 hours long.
What could they possibly do in 3 hours?
And it was so amazing. That's why I said I loved it. It was just a conversation. It was in depth. We talked about everything from just clinical trials. I mean, it was really amazing. It didn't feel like 3 hours. It actually felt like an hour.
Really?
Yes. And it went like that. And so it went really fast.
Wow. Did you ever get the sense that they were trying to convince you to work there? Like, that's the sense I got when I went on 2 interviews, and they were so easy interviews for me because they were just trying to convince me why I should work there the whole time. So it's like, okay, this is easy. Like, was it like that, or was it just a conversation?
It was kind of a conversation, just really getting to know me and see what I know and if I would be a great fit for the position.
So they pretty much already made their mind on paper. They're like, this guy, Christopher's got all the things we're looking for. He doesn't have CRA experience, but he's got tons of oncology, or not tons, but he's got enough oncology experience and enough coordinating experience we're comfortable with. Now we just make sure he's the right fit, like culture-wise for us, right?
Yeah.
Gotcha. Okay. Good. Congrats. So you start soon.
I start soon. I'm
Welcome
really
to CRA life. Are you going to be traveling a lot?
So yeah, about 60 to 70%.
Are you good with that?
Yeah, I'm good with that. I'm very flexible. I can get up and go, which is, one thing it is people like that you can be very flexible.
Yeah.
Um, then I love to travel. I know it will be different from work, but I'm ready.
Are they
Um,
keeping you like regional, like around Atlanta? Are you traveling like coast to coast? Are you going to California?
so I'll be over the southeastern region, but I think I will probably be traveling outside that region if needed.
Wow.
Yeah.
Congrats. And you got a pay increase, tremendous pay increase
Yeah.
probably. I don't know
Yes.
the details, but from CRC. Now, you know what's interesting? Some CRCs, if you stay long enough, you make what a CRA could make.
Yeah. I've heard
But
that.
to shortcut that is like a leap. Like you're taking a huge leap in your salary. If you go from like just like what you did, like a 2 year, 2.5 year CRC, you're not at that level yet where the site's not going to pay you that kind of money. So to jump from that to a CRA is like, I mean, that must feel really good for you. So congrats on that.
Thank you.
All the hard work paid off. I remember our text messages. I think we had some phone calls too, right?
Yeah, we did. Yeah.
Yeah, I remember. I was like, I think you can do it. Just takes effort and keep applying, basically.
Yeah.
So, congrats. I really appreciate you taking the time out to interact with me here and to give future Christophers. You know how many people like Christopher are out there that are frustrated like you were 6 months ago?
Yeah.
Every day I deal with them. Okay, so there's plenty of hope. Here's another example:
Yes.
CRC to CRA, and I mean, even beyond CRA, there's so many opportunities in this industry. So
Yeah.
enjoy your CRA life, Christopher. Stay in
I'm
touch with me, and we can do follow up interviews maybe in 6 to 12 months and see how things are going.
most definitely. Yeah.
I appreciate it, Christopher. Thank you. Anything else? Any advice you want to give Guru Nation listeners or viewers? Well,
I,
we have a lot of Atlanta people. A lot.
oh, really?
Tons of Atlanta people.
Wow.
It's like
So,
our biggest market.
oh, wow. I would just basically say you just really have to keep applying. You have to really keep going after it. If it's something you want, you have to work hard. You can't take no for an answer. Of course, sometimes it hurts when you're rejected from anything, but you have to, give your time, I always say, Christopher, give yourself 24 hours to be sad about this and bounce back and keep going. And you just have to keep applying and keep applying. Just be diligent and consistent because it's going to happen.
Mm-hmm.
Anything you do consistently and you're hardworking and you're determined, eventually it's going to happen.
If you know your stuff, that's the big if.
Know your stuff because
If you don't
and,
know your stuff,
and
it's not
that's
gonna
another
happen.
thing. And that's another thing. Also, when you get in these interviews, you can't fake it. You
Thank you.
cannot fake it. If you've never been in clinical research, the first question they're going to know it. It's going to be in-depth stuff if you've worked in clinical research, you're going to have to know it because
Right.
you have to know it, and that's what it is. Yeah.
The more experience, the better. Even intern, do anything you can. That's what we tell our students all the
Yeah.
time. So, thank you, Christopher. Best of luck to you. You'll do well as a CRA. And we got a network also because I do some oncology CRA too. So, thank you
Okay.
very much. And thank you, everyone, for watching and listening. And we'll catch you all later. Bye
All
bye.
right. Thank you.